Hello, everyone. Today we're going to talk about something that affects millions of couples worldwide, but often goes unspoken: unexplained male infertility. Picture this scenario. You and your partner have been trying to conceive for months, maybe even years. You finally decide to get tested. The semen analysis comes back. Everything looks normal. Sperm count? Check. Motility? Check. Morphology? Check. Your hormones are fine. The ultrasound shows no issues. Yet, pregnancy still doesn't happen. This frustrating situation is called unexplained male infertility. And here's what's important to understand. Unexplained doesn't mean untreatable. It simply means we need to look deeper than standard tests can show. About half of all infertility cases involve male factors, so if you're experiencing this, you're far from alone. Today, we'll explore what's really happening beneath the surface, the hidden causes your regular tests might be missing, and most importantly, what you can do about it. The limitation of standard tests. Let's start by understanding what normal really means when it comes to fertility testing. Most men undergo a basic semen analysis as their first test. This test looks at three main things: the number of sperm, how well they move, and their shape. If these check out, doctors often say everything is normal. But here's the problem. Semen analysis is like inspecting a car from the outside. Sure, it looks fine, has 4 wheels, a shiny paint job, but you haven't checked what's under the hood. You haven't looked at the engine, the transmission, or whether there's actually fuel in the tank. The same applies to sperm. A standard test tells you the quantity and basic movement, but it doesn't reveal whether the DNA inside the sperm is intact and healthy, if the sperm have the energy to complete their journey, whether they can actually penetrate and fertilize an egg, if they can support healthy embryo development. This is why you can have a normal report but still face infertility. The issue isn't with the numbers, it's with the quality at a molecular and cellular level that standard tests simply don't measure. And I want to address something important here. Many men feel helpless, frustrated, even guilty when faced with unexplained infertility. But remember, infertility is a couple's journey, not one person's failure. If you're experiencing this, it doesn't mean you're doing something wrong. It means modern medicine needs to look deeper, and fortunately, we now have tools to do exactly that. Hidden causes. So, what are these hidden factors that standard tests miss? Let me walk you through the most common culprits. First, sperm DNA fragmentation. Think of DNA as an instruction manual for creating new life. If that manual has torn pages or missing sections, fertilization might occur, but the embryo may fail to develop properly. This DNA damage can be caused by smoking, alcohol, stress, infections, exposure to toxins, or even a condition called varicocele. Standard semen analysis completely misses this. You need a specialized DNA fragmentation index test to detect it. Second, oxidative stress. Your body naturally produces molecules called free radicals. They're a byproduct of normal metabolism. When these increase beyond control due to pollution, smoking, obesity, or chronic stress, they act like rust on metal, attacking and damaging sperm cells. This damages the sperm membrane, reduces their ability to swim, and breaks their DNA. It's one of the biggest hidden causes of unexplained infertility, yet it's invisible on standard tests. Third, subclinical varicocele. A varicocele is an enlargement of veins in the scrotum, similar to varicose veins in the legs. Sometimes it's not visible or painful, but it still raises testicular temperature and creates oxidative stress, both of which harm sperm quality. Even if your ultrasound looks normal, a subclinical varicocele might be present. Fourth, genetic and epigenetic factors. Even when chromosomes appear normal, tiny gene-level changes can alter sperm function. For example, microdeletions in the Y chromosome can reduce sperm production. Epigenetic changes, chemical tags on your DNA, can incorrectly switch genes on or off, affecting how sperm develop. These are completely invisible on basic reports. What you can do about it. Now for the good news. Most cases of unexplained male infertility can be improved with the right approach. Let me break this down into actionable steps. Start with lifestyle changes. These might sound simple, but they're incredibly powerful. Quit smoking and limit alcohol. Both directly damage sperm DNA and can improve fertility within 2 to 3 months of stopping. Eat a fertility-boosting diet rich in antioxidants, colorful fruits and vegetables, nuts and seeds for selenium and zinc, whole grains, and omega-3 fatty acids. Avoid processed foods and sugary drinks. Maintain a healthy weight. Both obesity and being underweight alter hormones and reduce sperm quality. Exercise moderately. Think brisk walking or yoga, which improve blood flow and reduce oxidative stress. But avoid overtraining or steroid use. Get 7 to 8 hours of quality sleep to maintain healthy testosterone levels. Manage stress through meditation, counseling, or therapy. Medical support through supplements. Your doctor may recommend antioxidant supplements such as coenzyme Q10 for energy and motility, L-carnitine for sperm movement, zinc and selenium for sperm production, vitamins E and C to reduce oxidative stress, and folic acid with B12 to support DNA synthesis. Results typically appear after 2 to 3 months of consistent use. Treat hidden conditions. If testing reveals a subclinical varicocele, minor surgery or embolization may help. Silent infections can be treated with antibiotics. Mild hormonal imbalances can be corrected medically, and in select cases, immunological causes can be addressed with appropriate therapy. Advanced diagnostic testing. If conception still doesn't happen, consider tests like the DNA fragmentation index, reactive oxygen species testing, genetic screening, sperm chromatin structure assays, or scrotal Doppler ultrasound. These help create a personalized treatment plan. Assisted reproductive techniques. When natural conception remains difficult, IUI, or intrauterine insemination, places washed sperm directly into the uterus during ovulation, bypassing some transport issues. IVF, in vitro fertilization, combines egg and sperm outside the body. ICSI, intracytoplasmic sperm injection, injects a single healthy sperm directly into the egg, revolutionary for cases with high DNA fragmentation or subtle sperm defects. Advanced sperm selection techniques like IMSI, PICSI, or MACS use high magnification or magnetic sorting to choose the healthiest sperm. Here's what I want you to remember. Unexplained infertility is frustrating, but it's not hopeless. The label unexplained simply means we need better tools and deeper investigation. And those tools exist today. Whether through lifestyle changes, medical treatment, advanced testing, or assisted reproduction, there are pathways forward. Work with a fertility specialist who will look beyond the standard tests. Support each other emotionally. This is a journey you take together. And most importantly, don't lose hope. Science and medicine continue to advance, and many couples who once faced unexplained infertility go on to build the families they dream of. Thank you for listening, and I wish you all the very best on your fertility journey.
If you're watching this video, then like, share and subscribe to our YouTube channel. Thank you.